Ready.
Hi, I'm Isabel. I'm going to be doing a blood transfusion. I don't have anything on my iPad here. We're just going to use it as a stand for my phone to film. So first thing I'm going to do is I'm looking at my provider orders. So I see my patient, Jordan Taylor, has an order for 1 unit of packed red blood cells. This is due now, and it's going to be given through their IV. I currently have running normal saline in the blood tubing that I primed with the normal saline. It's running at a TKO rate, and the patient's IV site I assessed, it didn't have any signs of infiltration or phlebitis. It was patent, and it is an 18 gauge needle, which is appropriate for a blood transfusion. So I just did a first safety check there of my patient, my medication, my dose, my route, my time, and now I'm going to do LACE. So I have some labs here. They have a hematocrit of 18.6 and a hemoglobin of 6. They have had their type and cross completed. They're A positive, and that is just a preliminary look at their labs that would indicate this. It looks like they're acutely anemic. If I'm giving a blood transfusion, I'm also looking for any signs that there may be a risk for fluid overload, so congestive heart failure for one, but my patient does not have that, so we're all good there. I'm also looking in their history to see if they've had any previous blood transfusions. I see they have. I'm looking to see if they've had any previous reactions. They haven't. I'm looking to see if they have any documented allergies. They have not, but I'll also make sure to check that when I'm in the room. I'm also making sure that they have their consent form signed, which they do, and then they have a blood bank ID assigned to them. Some contraindications would be religious exemptions, such as Jehovah's Witness, if they did not have a blood bank ID, or if they were not type and crossed yet. And so now I'm going to, I'm ready to receive my blood from my lab. So I have my lab tech come in. I'm checking with the lab tech that this is the correct blood, A positive, that there has been a compatibility screen, and there has. It's the right amount, it's 300 milliliters, that it is not expired. It expires tomorrow. I'm also taking a look at the card that they give me as well, and I'm confirming with them. We'll do a read back method to make sure that it is the correct unit number. And I'm just observing the blood for any clots and contamination, and I'm looking to make sure that the package that it came in is intact, and it is. And then I'll have the tech sign off here. And now that I have my blood, it has to be given within 30 minutes of receiving. I will gather all of my supplies, and I will bring it into my patient's room. So, knock, knock. Patient privacy, hand hygiene. Hello, I'm Isabel. I'm your nurse. We're gonna get started with that blood transfusion. Can you just let me know your name and date of birth? Okay, correct. I'm just cross-checking what the patient says with their band, with my MAR here. So, like I said, we have our blood transfusion today. You are acutely anemic. Your laboratory results show that you have low hematocrit of 18.6 and a hemoglobin of 6. So we are going to get some blood transfused, and you're going to feel a whole lot better. Do you have any allergies that you're aware of? No? Excellent. Have you had a blood transfusion before? Yes? Okay. Have you ever had a bad reaction to the blood transfusion? No? Okay, great. I will just let you know some symptoms, if you experience them, to just let me know. They may be a sign of a reaction, so if you suddenly feel really itchy all over your body, if you have shortness of breath, if you have any pain at the site or just anywhere, let me know. If you have any pain in the lower back especially, please let me know. If you have any anxiety or feel like anything is off, do not hesitate to let me know, okay? I'll leave your call light with you, but I'm gonna stay with you for the first 15 minutes and periodically check on you just to make sure that everything is running smoothly, okay? All right, so I have here your consent form. Do you have any questions? Do you recall signing this? Do you consent to go forward with this procedure that I'm going to do? Okay, excellent. All right, do you have any questions for me before we get started? I'm gonna have a second nurse come in and verify everything with me. I'll set the pump and I'm gonna take your vitals a couple times throughout this whole procedure just to establish a baseline. So I'll go ahead and take your vitals right now, and then I will record them on the blood card here and as well in the MAR. I also just made sure before I spiked and primed my normal saline and got my blood tubing that everything was checked for expiration dates. I'm looking for the integrity of the packaging and just making sure that everything is all good and nothing is tampered with. And then I have a label on my tubing. The blood needs to be transfused within 4 hours, so the tubing will be discarded along with the blood per hospital policy in 4 hours. So the amount of time that you can expect, we're going to do 15 minutes of the transfusion, and then we're going to transfuse under 4 hours. It turns out to be a little over 2 hours. So, but I'll leave your call light with you, and I'll just be here if you need anything. Okay. So, all right, I'm going to have my second nurse come in and do my verification here.
Okay. That should be good.
Great.
Hello, second nurse here.
Okay, so first I will just have you verify that this is the correct patient off of the MAR.
So I have Jordan Taylor, Jordan Taylor. Date of birth is 12/23, and the MRN number is 6565245.
Excellent. And I'll just ask the patient, can you confirm your name and date of birth for us, please? Okay, great. All right, excellent. So I've confirmed with what is on the MAR with the patient's band, and now I'm going to have the second nurse look at the consent form and just confirm that we have that as well.
Yep.
Okay, great.
Right here for Jordan Taylor.
Okay, excellent. So now I'm going to cross-check the band with the blood card here. So I'll read out, I have Jordan Taylor, JORDANTAYLOR, MRN number 6565245, date of birth 12/23, and the blood bank ID number is NTC 6583.
Perfect.
Okay, I'll have you read that back to me.
Great. I have Jordan Taylor, JORDANTAYLOR. Date of birth is 12/23. MRN number is 6565245. And the blood bank ID number is NTC 6583.
Okay, excellent. And now I'm gonna read what I have on the donor bag to what we have on the card. So I have a 300 milliliter bag of packed red blood cells. The type is A positive. It expires tomorrow. The unit number is 0135703.
So I have the packed red blood cells. The expiration date is tomorrow. Total volume is 300 milliliters. A positive, antibody screen negative. The cross match was completed and it's compatible. And the unit number is 0135703.
Okay, excellent. And I have Jordan Taylor. I'll just read off of this. It says type and cross completed. It is A positive. I'll just have you confirm with that, and that it's on that as well.
Yeah, no worries. Yeah, so I have type and cross completed, A positive. Beautiful.
Okay, great. Thank you so much.
Of course.
Okay, so now I am ready to hang my blood now. So I've got my first set of vitals. Oh, I also called my nurse back in, had her do the signature. I'm gonna do my signature, and I'll get started. So I'm gonna do some hand hygiene. We were always wearing gloves when we were handling the blood bag. So I am doing aseptic non-touch technique with this here, so I'm going to take this off, like my bag. I'm gonna just pause the pump and I'm gonna clamp everything. I have this one clamped, I'll just clamp this guy, and now I'm going to unclamp, prime my lead, and I made sure to prime the saline to the top of the disc. I would just tap this out to make sure that there are no there are no bubbles. I made sure to prime that to the top of the disc so that there's no hemolyzing of the red blood cells. And now I'm going to do my rate. So I want it to run at 2 milliliters per minute for 15 minutes. So I'm just going to channel select. And I'm going to actually turn my channel off so that I can change what is running. And, okay, so I have my guardrails, IV fluids, page down, packed red blood cells, correct. So since I wanted to run at 2 milliliters per minute, and I want that to run for 15 minutes, I'm gonna do 120. It's gonna run for 30 milliliters. And then the volume duration will be 15 minutes. And, oh shoot, sorry, I got ahead of myself. We're hyperpriming first. Don't yell at me. Just gonna cancel, save. Okay, so. Channel select. IV fluids. Okay, so we're hyperpriming for 30 mils, which is about the length of the tubing here, so that the blood gets to the patient, so that I don't start my timer before they have the blood in them and miss signs of a reaction. So I'm just going to unclamp everything here. Make sure I'm good. Okay, so now I'm going to start. It's asking me if it's okay if it exceeds this, and it is, because we're just hyperpriming to the patient, and then we're going to pause it. So I'm watching very carefully. My finger on the pause. Okay, and I see that that's turning pink, so I'm just going to pause that, and now I'm going to change my rate here. So I'm going to do a rate of 120 mils per hour. I'm going to do volume to be infused 30 mils, volume duration 15 minutes. Okay, so I've already taken my first set of vitals. I've recorded those, and now I'm going to go ahead and start the transfusion now. And then in 15 minutes, I'm going to reassess the vitals. But please let me know if you feel any of those signs of a reaction that I mentioned before. Okay, so I'm going to go ahead and start. Okay, so while this is transfusing for 15 minutes, I'm going to enter my vitals. I'm going to enter my assessment of the IV site, what is running, the rate that it's running at, how the patient is tolerating so far. After the 15 minutes, that their consent was signed and that we did the 2-nurse check and everything was verified. Before doing all that, after finished programming the pump, change my gloves, do hand hygiene, make sure that the patient is in a safe position, with a low locked position on the bed. And then I'm just staying with the patient, making sure that they're okay. Once the 15 minutes is up, I am going to pause. I'm going to redo my vital signs. They are the same. We're going to record those. I also forgot to mention that if it was indicated, I would pre-medicate my patient with Tylenol or Benadryl because there are just mild reactions that might happen, like a slight elevation in temperature, and so we would want to just make them comfortable during this whole thing and pre-medicate. So, all right, so I've done my second set of vitals. Now I'm ready to reprogram my pump to the correct rate. So I'm just going to change my volume to be infused to 270. Oops. 270. Because we infused 30 milliliters of the bag, and now we want to infuse the rest. So we're going to do 270 milliliters, and that's going to run for just over 2 hours. So that's within the 4-hour time period. Once this is finished running, I'm going to periodically check on my patient during the procedure, and I'm going to make sure that they're comfortable, and if they need to go to the restroom, I'm going to make sure that they're left with the call light in reach, and that they know that to call me. Once all of the blood has finished transfusing, I'm going to flush the line with normal saline to ensure that all of the blood gets to the patient, as is best practice. I changed my gloves and did hand hygiene after I touched the pump. And then, I'll record my final set of vitals, just to make sure that everything is all set there, and then I will discard of the blood bag and the tubing as per hospital policy. As for documentation, I'll document all 3 sets of their vitals that I took, the before, after 15 minutes, and the final set. I'll document, again, I'll periodically be assessing their IV to make sure that there's no infiltration and that it's in place. So I'll be documenting that, how the patient tolerated it, if they had any reaction, and that it was 1 unit of packed red blood cells that was infused. And yeah, that's it.